Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Hi, thank you so much for tuning in today for this episode of Being Well. I'm your host, Keanne Armstrong, and we are going to be talking about bariatric surgery today. So for all of those out there that have questions about this, we're here to answer them for you. And I have Dr. Cozacov from Horizon Health in Paris. Thank you so much for joining me today.
Hi, thank you for having us.
Yeah, I'm interested in this topic. I've heard about it, but I really don't know anything about it. And so for folks out there who are tuning in, I'm hoping that we can get some useful information out to them.
Absolutely, yeah.
So,
yes.
Bariatric surgery. Tell me how you describe that to folks.
So, bariatric surgery, the name bariatric means weight loss. So when we used to say bariatric surgery as a weight loss surgery, and that has, as we learn more about what bariatric surgery does and how it works, we added the name metabolic surgery. So it is now called bariatric and metabolic surgery. So it's not only weight loss, but it also affects the way our body works and functions in different ways. So now it's called bariatric and metabolic surgery.
Okay, so is there a different procedure for each one, or is it the same?
Well, they used to be. So, for example, the laparoscopic band that people hear about, something you might see it on commercials or hear on the radio. The band, what it causes a restriction. So there's only a certain amount of food that you can take in. And a metabolic surgery, for example, what we call the Roux-en-Y gastric bypass or the sleeve gastrectomy that you hear a lot about. In the bypass, you reroute the intestine, and in the sleeve gastrectomy, you remove a big portion of the stomach. And the end result is not just the restriction of the amount of food you can intake, but also it affects the hormones that our stomach secretes and that our body works with. And so those are the differences, what we used to say. So the band used to be a bariatric surgery, and now we talk about Roux-en-Y gastric bypass and sleeve gastrectomy. It's also a metabolic surgery.
Okay, so it's not just the band.
No. There's been, throughout the history of bariatric surgery, there's been several procedures. Some have been more adopted and some have been abandoned. So the band, for example, is something that is now very much in decline, pretty much abandoned. Only 3% of the country still do that. And the new metabolic surgery that we know about, the sleeve gastrectomy, in the past decade has become really popular.
Okay. Well, you're a general surgeon.
Yes.
But you specialize in bariatric surgery?
Yeah, so I spent close to 2 years at the Cleveland Clinic in Florida with a surgeon named Raul Rosenthal, and he's really one of the pioneers in bariatric surgery, and especially in the sleeve gastrectomy. And he's just the former president of the Society of Metabolic and Bariatric Surgery. So I started in the United States. We worked together for 2 years, and that's how I got my interest and really delving into bariatric surgery and what it means and how to do it and so forth.
Yeah, that's interesting. Now you're new to the area with Horizon Health. You said you've just been here a short time.
Yeah, so my partner, Dr. Lee, we worked together at the Cleveland Clinic in Florida, and when we worked together, Dr. Lee is one of the smartest people I've ever met. And when a position opened at Horizon Health, for me it was a no-brainer, literally no-brainer to come here and join him in his practice.
Yeah. Have you performed a lot of these surgeries since you've been here?
I've been here only for a year. We just started recently, and we have already, we've done a few, and Dr. Lee has been here for the last 3 years, so he's done also a decent amount of over a dozen of amounts of bariatric surgery, and so far we have good success.
Good, that's great news.
Yeah.
So for folks who are thinking about this, let's talk about, is it just for people who have an obesity issue? Is it what's the parameters in knowing that this is something that they might need to look into?
Well, obesity is more complex. We call obesity and morbidly obesity, but we really have to understand what it means and what it does to ourselves, to our bodies, and realize it's a disease. It's not a condition. It's not something you can just. It's hard to just treat it yourself. Let's start with obesity, how it causes and what brings it up. How do you get obese? How do you get to that point?
Right. Let's do that.
And we're still working on that. We believe that there's a lot of research going on. We believe that some factors have to do with genetics, and some factors have to do, with the food that we take, the food that we eat. It's a lot of processed food. It's really the diet is not really diverse as it should be. But you can't just blame it on that. We have to understand that at this point, the proportion of obesity in America, and not just in America, in the whole world, is about we call it a pandemic. It's a disease that's spreading all over the world, and just in the United States, about a third of the patients are normal weight, a third of the patients are overweight, and over a third of the patients now are morbidly obese. And we have to know how obesity affects our body and in what system. So we have to go through each one of them to really understand that. So obesity causes, on one hand, a chronic inflammation in our body, and on the other hand, there's also just having that extra weight. If you can imagine just all this extra weight sitting on our belly, pushing up on our lungs, pushing down on our bladder, and it also compresses the big veins, the big vessels in the back of the belly. So you end up what we call with increased intra-abdominal pressure, and that affects your heart, and that affects your lungs. Many people have urinary incontinence because of that. And the chronic inflammation part, the metabolic part, the number one problem that we have with obesity is diabetes. If not everyone who have diabetes are obese, but pretty much over 85%, 90% of diabetic people are obese. And the higher your BMI is, the more likelihood you're going to have diabetes. BMI, by the way, is just a formula that we use to kind of describe diabetes. It's hard to say just by weight, so we divide the weight by height and we go by that.
Okay. And it's concerning how much fat is in the body. Is that what BMI?
BMI is just your weight divided by your height. It's just an easy way to formulate. And when we try to talk about obesity, there's different bodies, different shapes. We used to talk about the waist circumference. There's the apple body and the pear-shaped body and all that. So the BMI came up as just so we have a common language when we talk about obesity and those sorts of things.
Okay. So when you do talk about obesity and morbidly obese, what's the weight that someone should consider themselves in that category to look at a surgery such as this? Like, say, I'm 5'8", and let's.
So there's tables for that. It's pretty easy. You can go on Google and say, what's my BMI? And there's a calculator. You put in your height, you put in your weight. And the categories are divided. If your BMI is between 20 and 25, then that's considered normal weight. If you're between 25 and 30, you're what's considered overweight. And above 30, you're starting to be obese. Above 40 is what we call class 3 obesity. Then we add the word morbid obesity.
Okay. All right. So for someone who thinks maybe this is something that they want to look into, what are the steps to take? Is there like things that they need to do? What's the steps?
Well, first thing is one understanding is you have to realize it's a disease.
Okay.
And it affects your heart, affects your lungs, causes diabetes. And then you have to have a realistic goal of what bariatric surgery is for. If someone's going to come to me and say, I have a wedding in a few months, I want to lose some weight, I'm going to say that surgery is not for you. This surgery is meant for people who want to change their lives, who they want to get out more, their diabetes is, they understand, the problems with diabetes, and they see, diabetes. Okay, I have now diabetes, no big deal. But what's going to happen 20 years down the road? How diabetes is going to affect me then? So, it is in a lot of cases, it is a cure for diabetes. It is a cure for high blood pressure. It is a cure for the sleep apnea. It's a cure for urinary incontinence. So you have to come. So it is for people who kind of consider this as a big lifestyle change. You kind of get to the point. It's not obese. I got a wedding. I just don't like the way I look. Mm-hmm. But it's actually affect the way you live, your quality of life, and everything around it.
So for people who may be thinking, I've tried everything. I've tried to limit my food intake. I've tried to do all these diets. Nothing is working. So is it that a diet won't work? Is it a lifestyle change that they need to work on more before taking this into consideration? What about that?
Yes, it's hard to, that is hard. It's not just, people have a lot of willpower, and people can go on a diet and lose 100 pounds. But what our body does, we gain it back. There's a couple reasons for that, and we're just starting to understand now. To understand that in the past, in the past few years, is that first thing that happens is that we have hormones in our body, and when we talk about bariatric surgery, those hormones, this is how it helps those hormones. So there's a hormone that's called ghrelin. It's a hormone that induces appetite. When it's high, it just tells your brain, I'm hungry. The bottomless pit that you feel like you just can eat a lot. So that hormone is partially responsible for that. It's not just one thing. There's so many entities that work together, but ghrelin is one good example. So if you go on a diet, a low-caloric diet, what we say, you restrict your calorie intake. Mm-hmm. You don't need a lot of carbs, not a lot of fat. That ghrelin goes up high. It gets higher. So you're going on a diet, and then you're just constantly hungry, and that's a common feeling.
Darn that hormone.
The other hormones there's some other hormones that kind of induce satiety, that, I'm hungry, I ate, and you get that feeling. Sometimes you go to the plate and I'm done. Mm-hmm. I don't want to eat anymore. Mm-hmm. So those kind of hormones that tell our body, tells our brain that we're done, we're satiety, we're full. When you go on a low caloric diet, if you go for 10 weeks on that diet, and this is things that they've tested, and this is research that's been done, and after 10 days they check those hormones, your ghrelin is going to go sky high, and the satiety hormone are going to go down. You're not going to feel full. You stop that diet after 10 weeks, and now you go back normal, just eat normal food. They recheck those hormones a year later. Those hormones never came back to normal. So a year later, you do a 2.5 months of diet. A year later, you're still going to be hungrier than you were a year ago. On top of that, you're not going to be as full, you're not going to get that sensation of satiety as you used to get before. And on top of that, our body does something amazing, is that, evolutionary. When you go on a diet, your body tells, slow down the metabolism. Mm-hmm. Our body, normally we have what's called a basic metabolic rate. So you're just sitting down, not doing anything, your body uses energy, your body burns up calories. If you go to the gym, you burn more, but just sitting down is not zero, you're still burning calories. And when you go on a diet, your brain tells your body to slow down, not burn as much as calories, not produce heat, and just your metabolic rate of all your cells just goes down. So what happens is your body actually gets to preserve more energy. So you eat, you're hungrier, you're less has satiety, mm-hmm. and your body now slows down the metabolism compared to a normal guy. So you're going to gain more weight, and this comes to all that kind of comes together with what's called the set point theory, that the energy that we burn, the calories that we burn, is so tightly regulated. A lot of people, you eat the same and your weight doesn't change. You can eat one day a lot of ice cream and the next day eat nothing, and your weight is going to be the same. Your brain has kind of a set point of a range of weight where it wants to keep your body at. And when you go on the diet, you do this binge diet, you're 10 weeks, you try to lose weight, your metabolism goes down, you get hungrier, less satiety. On top of that, your brain tells you, listen, something's going on, we better get ready for the next strike. The set point goes up. So now when you're going to eat, people say, I lose 10 pounds, I gain 20. So that what happens is that your body now wants to store more energy for the next time it thinks it's going to be a diet, because there's no such diet in nature. There isn't such a thing, evolutionary-wise. It means there's a feather or something or a famine, and your body just tells you you need more energy for the next time this happens. So that's why it's so hard to diet, and it's really hard to lose weight.
Yeah, it's frustrating.
Absolutely. But I want to mention on top of that it is frustrating a diet. I don't want to say folks don't do a diet.
No, that's not what we're saying at all.
The other thing that we have to understand about morbidly obese is that you can be morbidly obese and actually be malnourished. Malnourished, you don't have to be, just skin and bones. You can be actually morbidly obese and malnourished. Malnourished in the way of you're lacking vitamins, you're lacking certain minerals, certain compounds that your body needs, and that comes down to poor food choices, and also the food that we have available for us. A tomato is really expensive, but a dollar meal at McDonald's is really cheap.
Right.
So it's really hard for us. So as far as the diet, there's what I want to say to folks is get good nutrition. Eat a lot of vegetables, eat a variety, eat fruits. It's okay to eat meat and fish and chicken, but kind of in moderation. But the most important thing is variety, and eat lots of fresh.
Yeah, it's a lifestyle change and choosing what goes in your body.
Yes.
All right, so let's go through the steps. Like if somebody came to see you, what steps do you have to take before you get this surgery?
Well, the first thing we talked about, you have to come to the realization that this is something you want. The second thing that would happen, I would go to my primary care physician and I would ask him, have a discussion about what it is, what are expectations, and what do we think. So I think the primary discussion should be with your primary care physician. And if he thinks that you're a candidate or you think that you should have the surgery, then he would refer you to a surgeon. But some people come to us directly. They want to ask questions and ask us, what it is and what to expect. We go with what is called, before you have the surgery, you have to undergo, in most cases, what's called a 6-month program, where once a month you have to meet with a physician, a nutritionist, or a surgeon, and kind of where we implement the lifestyle changes. And we talked about diet. Some see it as a hurdle to get the metabolic surgery, but I think it's a good thing. Because you learn a lot about food and calories and what's fat and what's protein and what's carbohydrate and what's nutritionist and how to look at labels. So there are a lot of things go through that, and also get mentally prepared to have bariatric surgery, because after that your life kind of changes. So first of all, there's those 6 months that it's part of, it's a bariatric program that you go through. And then before the surgery itself, we meet one more time. We do what's called an endoscopy, make sure nothing's going on in the stomach. And after that's done, we prepare you for surgery.
What are the risks involved?
So people ask that a lot. Is it safe? I mentioned before that we work with one of the pioneers in surgery, but the pioneerism of bariatric surgery, in my opinion, is done. We have at this point, we know, we have the knowledge and we have the ways of doing bariatric surgery in the right way. There's, like I said, there's a lot of ways to do bariatric surgery, but in the last couple of decades, we have standardized it and made the surgery as safe as possible. Undergoing a bariatric surgery today, as far as mortality, dying after surgery, is safer than having your gallbladder removed, is even safer than having your hip replaced. So right now, the safety of bariatric surgery is pretty high.
Is there a hospital stay required? Is it an inpatient type of surgery?
Yes. So after you do the surgery, you stay with us 1 to 2 nights, and after that, you go home.
Yeah.
Yeah.
And so you take your education that you learned the prior 6 months, and you put that into play.
Absolutely. Yeah. Now it's go time.
Now it's go time. So is this a be-all, end-all fix? Can you gain the weight back? What's the results like?
So bariatric surgery, like everything in life, is not 100%. About 10 to 15% have a failure. But talking about weight gain, so you do regain some weight, and that is normal after bariatric surgery. The most weight you're going to lose is after a year, and then you're going to gain a few pounds every year. You're not going to go back to where you were before. On average, depending on the surgery, if it's a sleeve gastrectomy, you lose between 60 and 80 pounds. If it's a Roux-en-Y gastric bypass, between 80 and 100 pounds. You're never going to go back. So you're going to gain a little bit of weight afterwards, and that's normal. But the effects of the surgery are not gone. The effects of the surgery are not only dependent on your weight. The metabolic part, the hormone changes that happen in your body, they are there to stay. If we have people who are diabetic and we just treat them with diabetic medications and lifestyle changes and exercise, and we take the same folks and we do bariatric surgery, and after a couple of years we look at the same folks with the same weight, we see that patients who had the bariatric surgery, their hemoglobin 1AC, that's what we monitor diabetes with, is significantly lower, a lot lower than it was without the surgery. So you're going to gain some weight, but the effects of the bariatric surgery are not only weight dependent.
So is it safe to say that some folks may not have to take quite as much medicine, or they may not have to take diabetes medicine if they get a surgery like this, make the lifestyle change, and
absolutely.
Is it safe to say that?
Yeah. Well, not everyone, but the numbers are pretty good. So, we know that maybe about 60 to 70% of folks who were taking insulin are going to come off insulin, and some of them even the next day after surgery, they're not going to need insulin anymore. It's that fast. But as far as overall medications, some people take one medication for diabetes, some people take two, and some people take three or more. The amount of folks after bariatric surgery, for example, after sleeve gastrectomy, if you're diabetic, if before the surgery, if we take a group of patients, about 45% of them would take insulin. After a sleeve gastrectomy, only 11% would take insulin.
Wow.
If you do before surgery, or you compare people who are just managed with lifestyle changes and exercise, if they take medications after surgery, 25% of folks don't need a single medication for diabetes. But it's not just for diabetes, for high blood pressure as well. A lot of people take 1, 2, and even 3 medications or more for the blood pressure. After bariatric surgery, that goes down. About half the folks after bariatric surgery don't have high blood pressure anymore. And back in the day, they used to call high blood pressure the silent killer, because we didn't know. But with time, if it's not managed properly, it can give you coronary heart disease and aortic disease and so forth.
Yeah.
So it works on that. It works, sleep apnea. Sleep apnea is when, morbidly obese, what they have is you just have a lot of fat around the neck, kind of crushing down on the windpipe. And sleep apnea, it's a horrible disease that a lot of people don't realize that. If you have sleep apnea, if you have someone who's snoring in your family, have them check it out, have them do the sleep study. So sleep apnea resolves in 80% or even more of patients after having bariatric surgery. So that's, we believe that bariatric surgery is really a real lifesaver. Yeah,
it sounds like it. We only have about 30 seconds to a minute left. Is there anything that you want to say to folks who are watching right now?
Well, I want the main message I want to get across is that obesity is a disease. It's not, there's a lot of prejudice against it, and I think it's time to stop. We have now a campaign, it's called Time to Act. All you have to go is Google Time to Act, and you'll see videos and you'll see some more information about it.
All right. Well, thank you so much. It's been very interesting learning about this, and I hope all of you who have tuned into this has received the information that you were looking for. Once again, thank you for joining us. We'll see you next week.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.